I present to you the case of a 54-year-old male patient that presented to our emergency department with left-sided hemiparesis. You can see here in the temporal lobe, in the frontal lobe, in the insular cortex, in the internal capsule, and the right-sided basal ganglia. So this patient has an aspect score in non-contrast CT of 4. In the CTA, we see an occlusion here, proximal occlusion of the right-sided internal carotid artery. And the reason for that is an occlusion, a thrombus at the distal internal carotid artery at the right side. And there's an occlusion of the right side MCA, an occlusion of the ACA here. If we look on the CT perfusion maps, we see here on the CBF a perfusion deficit in the right-sided MCA territory, and on the CBV map we have a mismatch. And Cercare presents to us these results in the so-called hypoperfusion core overlay map that shows us here in yellow color the hypoperfused area and in blue color the infarction core. And it also calculates the core volume of the infarct, which is 120 milliliters here. The hypoperfused volume of the infarct, that's 279. And the mismatch volume here, so the parenchyma that is not yet infarcted, is almost 160 milliliters. And the mismatch ratio is 2.3. Cercare also presents us with the LVO map, so the map of automated detection. And it shows here on the LVO map, just like we saw on the CTA, an occlusion of the distal internal carotid artery on the right-hand side. In the green overlay, the occlusion of the internal carotid artery on the right-hand side is indicated, so we have a carotid T occlusion. If we look at the Cercare advanced maps, just as we saw on the overlay map, the oxygen extraction is higher than on the contralateral side. And here in the temporal lobe, we have a decreased OEF, which indicates that this is infarcted parenchyma. And what we find in many patients is that on the CMRO2 map, temporal lobe, we have a decreased dark blue parenchyma here, indicates parenchyma with decreased metabolism. Dark parenchyma on the CMRO2 map corresponds quite well to the infarct volume in follow-up CT.